The following podcast is taken from a live broadcast on Inspire FM.
Assalamu alaikum everyone, and welcome to Sisters Speak. You're here with me, Fareen, and we also have Lamisa with us. Today's topic, we're going to talk about welcoming the new year and 2024. If you want to call us or give us a message, you can call us on 01582. Well, you can just message us on Instagram at Sisters Speak. Lamisa, if you're there, can you say hi?
Hello everyone. Assalamu alaikum.
Lamisa, can you let everyone know what our show is about, please?
Yeah, of course. So our show is a platform for Muslim girls and women to voice their opinions on various events that are going on at the moment. We just want to let everyone know that all opinions and views are our own, and we respect all other similar or opposing views and opinions.
Thank you. If you remember the number, they can call us on if you want to share that with everyone as well.
Sure. So if you want to text your thoughts in, you can text in at 07779 481822. And you can call in as well to the studio on 01582 481822.
Thank you. So like I said, as I said before, we are going to talk, our main topic is going to be welcoming 2024, what we expect from the year, what we want to learn, our kind of what we want to do this year. But before that, in our first half, we're just gonna do our segment, which is called Thought of the Week. We just share something insightful that has happened to us during the week, or just anything in general. So let me start. What is your thought of the week?
What is my thought of the week? I think recently I've been thinking a lot about how I want to improve myself, and I think it kind of goes in line with our main topic as well. But how I can improve myself and things like that. And I was actually listening to a talk by Omar Suleiman and his series, the Judgment Day series. And I think in the first one, the first thing that he talks about is think of your deeds as your children, and kind of cultivating them in that way. And I thought that was a really profound thing that he said, because we never really look at, or I never really look at my deeds in that way before. But it's more about kind of putting time and effort into your deeds, thinking about them, being intentional about them. And if you look at it in that way, I feel like it kind of sets you up to be able to be more deeds focused. And then you spend your time doing things, intentional things, and it ends up, obviously working out for the better for you. So yeah.
Yeah, I completely agree. And I think we've said this in a show before, but doing our deeds, they're so small sometimes, and but the reward is so big, we don't even know we're doing a good deed. How are you trying to be intentional about them? Oh, sorry.
Yeah, that's exactly what I was going to come to, actually. I think before you do anything, taking that intention to think about Allah and maybe the ways in which that this might be good Islamically is one way of turning every single small thing that you do into a good deed. For example, things that we do a lot of the time, like studying. Young people in the UK spend a lot of time studying, and if your aim with that studying is to end up eventually doing good for wider society or for your family and for your parents and things like that, even that studying becomes a good deed. So yeah, I think intention is really important, and just thinking about it and having that niyyah before you start doing whatever it is you're going to do. That's one way of being intentional about it, I guess.
Yeah, and intention is a thing that you get so many rewards just for intending. For example, going to prayer and you miss it, just the intention that you made to go to prayer is enough for, to get that good deed. So thank you, Lamisa, for sharing your thought of the week. Is there anything else you want to add?
No, that's my thought for the week.
Okay, let me share my thought of the week. My thought of the week is, I was just thinking about how great, I think I've said this in the last show as well, but how grateful we have to be for what we have, and how we spend our New Year's, welcoming into 2024, and, under a roof with our family. We had a dinner and everything, but there's people that, they're not lucky to have that. And just for us, we just have to be grateful that we have our family around us, and we have food, we have a, roof under our heads. So that's kind of my thought of the week. Anything you want to say, Lamisa?
Yeah, I think that you're very right, for being grateful is something that we need to, not just this time, but all the time, throughout the year, thinking about how lucky and grateful we are, and to be in the position that we are. it's a blessing. And I think it helps actually with your like attitude from day to day. If you're grateful for the things that you have, you generally end up, taking things more on the chin, if that makes sense.
It does. You know what I've realized? The more you struggle in life, the more you're least likely to help other people who have went to that same struggle. So if you are grateful and you have, whatever you need, then helping someone is not going to take anything from your kind of what you have. I don't know if that made sense. It was a bit messy, but if you went through the same struggles and you see a person that's going through the same thing, then the first human instinct will be to help them. But it depends on people's personality. But that's kind of my thought of the week.
Nice.
Thank you, Lamisa. So, our hot topic is doctor strike, and we have obviously Lamisa, our future to be doctor, inshallah. So Lamisa, and I'm just gonna let you lead on this topic because obviously you know more about it. So whenever you're ready.
Thank you, Farine. So yeah, we're going to be talking about the doctor strikes, the junior doctor strikes that are happening at the moment. Actually, they started today. They're running from 7 a.m. today to next Tuesday, 7 a.m. And it is a junior doctor strike, meaning that all doctors that basically aren't consultants can go on strike if they want to. And I guess, firstly, I would like to ask all of our listeners actually what their thoughts on this are, because I know that a lot of people are very divided on the issue of doctors being able to go on strike. There's loads of questions of whether it's ethical and, what the implications of them going on strike actually is. So it would be really interesting to hear from our listeners what they think about the whole thing. And I will just repeat the numbers again very quickly. So 07779481822 if you want to text or WhatsApp in, and then 01582481822 if you do want to call. I think it would be really interesting to hear what everyone has to say. But with regards to the strikes themselves and kind of what they're for, so junior doctors are striking for a pay restoration. And so what that means is a 35% increase on their current pay rates to match the rates that they used to get paid back in 2008. So since 2008, junior doctors' pay has been cut by more than 25%, and that is a figure from the BMA, which is the British Medical Association. And so they're striking in order to restore that gap. Okay, so that's what the 35% pay increase kind of means. And if we look at, and I know 35% actually sounds like a lot, and it is because they've been cut by a lot since 2008. But if we look at actual figures, like numbers wise, the average kind of junior doctor pay, this was an article that I read, said that on average, like a FY1 doctor, which is a freshly graduated doctor out of medical school, their hourly rate is somewhere like £14.09. And this is something that The Guardian reported back in March 2023. 35% increase on that, let's say from £14.30 an hour, only goes to about £19.30. So in actual terms, it's about £5 increase on the hour, which is what it looks like for an F1, which is a newly graduated doctor. So yeah, that's kind of the backdrop of the situation. And I guess the reason why a lot of doctors are striking for this is because of the fact that since 2008, we all know that living times are a lot more expensive. We've covered the cost of living crisis on our show quite a lot. It's really expensive to be living in the UK currently at this moment in time, and a lot of people's wages don't match up to that, and doctors are kind of no different, to be honest. I was looking at an article also written in The Guardian again. It was titled The Cost of Living Revealed, What £15 Can Buy You in 2008. And it's just kind of comparing the price of things now to things 15 years ago. So, for example, a pint of milk was 50p, less than 50p back then. It's about £1.05 now. 12 eggs were £2.47 back then, £3.36 now. If you think about the way in which prices have gone up, a 25% cut since 2008 on people's pay is not going to make things possible for them to be able to do this line of work, which is being a doctor, and kind of live day to day, if that makes sense.
Yeah, it does make sense. And it's such a hard job. I couldn't imagine, The pay that they get is not enough already.
So yeah, go ahead, Ruth.
Sorry, I was just gonna ask you something. Is there anything else you want to say?
Yeah, there's quite a few things.
Oh, okay, go ahead.
It's a very big. Yeah. No, you can ask your questions now if you want. What?
I was gonna ask you if how is this gonna impact the healthcare system if there's so many junior doctors going on strike?
That was a really good question, and I think loads of people have kind of looked at and discussed the actual impacts. Obviously, we know that if you have a hospital and you don't have the doctors there, but you have all of the patients, there's going to be quite a few different issues. Patients aren't going to be seen. Waiting times on those days are going to be really, really long. People's care will be delayed. That is true, but that's the point of the strike, I guess, in essence, because of the fact that it shows the importance of a doctor. It shows the fact that we need doctors for the NHS. We need everyone in the NHS, let's be honest. The NHS is running based on the, efforts of the people who work in it. And if we're going to be underpaying doctors that massively, obviously this is my opinion, it's a very personally formed opinion, but if we're going to be underpaying doctors that massively when, all around the world, their value is a lot higher, it kind of makes it difficult for us to not go on strike, or not us, but doctors in general to not go on strike. So yeah, there is a lot of talk about, the impacts that it's going to have over these next few days, 5 or 6 days. But I did kind of look at what the actual impact was. And I think the Health Foundation ran a kind of study, I guess, to look at, what big of an impact it's having. And they found that basically the waiting list times had only gone up by 3% during the strikes. And if we look at other effects on waiting list times, there are other contributing factors that make a much larger contribution to that.
Mm-hmm.
So I guess in that sense, obviously you're going to have effects on the system with your doctors going on strike, but I think there is a solution for that, and the solution is to make sure that they're paid how much they want. That's obviously my opinion. But yeah.
Is there any way the hospitals are going to prepare for the strikes? Are the junior doctors, do they have to say we're going on strike?
So it's obviously the BMA has announced that they're going on strike, and the doctors who are going to go on strike would probably let people know about that. With regards to how they prepare, so I was in a hospital yesterday, and basically they're trying to do as much as they can to make sure that people's discharges and things like that aren't delayed. The other thing that is also in place is that staff can be requested to work if there's an unpredictable emergency and all other avenues have kind of been exhausted. So that's kind of with regards to emergency cares. But I just wanted to touch on the fact that striking is somewhat of a luxury for some people as well. So a lot of doctors do want to go on strike, but actually can't because of the fact that they've already been on strikes over the Christmas period or during December time, and they literally can't afford to take days off work unpaid, which I think was quite interesting because they can't even strike for their pay restoration because they don't have the money to be able to go on strike. Does that make sense?
Yeah.
How crazy is that? And I think a lot of people don't realize how difficult it is for especially those at the lower pay grades to kind of get by, because those who come from wealthy backgrounds perhaps will be able to get by, but medical students and people of low income backgrounds who go into this are usually the ones that are quite largely affected. And medical, junior doctors shouldn't be just from backgrounds that have wealth and, generational and family wealth. Doctors should be of all different backgrounds, and therefore we have to pay these people the right amounts of money for the effort that they put in over the years. On average, a medical student's student loan goes to £70,000 to £90,000. And those that are from lower income backgrounds have a higher debt because they are able to take out larger kind of maintenance loans and things like that. They have to pay that back straight away. If we look at graduate entry medical students, they get access to much lower financial support from, student finance, the student finance company, and things like that. So
these types of people who don't have a lot of access to money whilst they're going through their medical training are scrimping anyway. After they graduate, things don't change as much. And if we look at kind of rent prices and things like that, renting a room in London, for example, and this is just a single room, the average prices go from like £700 to £1,100. If you're spending £1,100 on rent and then you have living expenses on top of that, you've really not got a lot left over to kind of go by for day-to-day expenses. So yeah, I guess it's a very difficult situation. I don't think doctors want to go on strike and actually leave their patients, but I think it's something, this is my personal opinion as well, it's something that has to be done because of the fact that it doesn't make sense to be not paying them in line with the cost of living crisis and how living expenses has changed.
And from the salary that they're getting, do they have to pay back that student finance debt, so repay it from that same salary, right?
Yeah, of course. So every single month, the student finance your student loans will go out of your salary. I think another thing we have to look at is the number of doctors that are going overseas as a result, because, doctors do get paid a lot more overseas. This was a study done by the BMA in 2022, or a report, sorry. And it found that 4 in 10 doctors plan to leave the NHS as soon as they find another job abroad. Mm-hmm. And then a third of the 4,553 respondents plan to work in another country over the next 12 months, which is quite telling, I think. And in medical school, a lot of talk amongst medical students that I've personally seen, this is just my personal experience, a lot of people are quite geared to going abroad and working abroad purely because the working conditions are so much better. With regards to this, I think looking at the numbers and looking at statistics is really important because of the fact that a lot of us don't have that kind of statistical knowledge to understand numbers when they're coming out, because they come out in such big figures and they kind of go over our heads, and I'm exactly the same. But I think looking at these numbers and actually trying to understand where they're coming from is really important. For example, that 35% compared to £5, it doesn't seem as much. And I think this is a way that articles and media can frame stats to kind of push across what their motive is, if that makes sense. So yeah, I think looking into a bit more is really important. And just trying to understand the reasons as to why doctors are going on strike and why it's important. Because I think in the longevity of things, with the way the NHS is going, it's important that we hold on to all of the professionals that work within the NHS, because it's such a good system, in my opinion. And it would be a shame to not have it in the way that we know it.
Yeah, I completely agree. Is it different for junior doctors in public kind of services, or is it just the NHS?
The NHS is the public health service.
Yeah, so I mean in the private ones.
Oh, in the private ones. I'm not sure entirely about the private ones. These are doctors that are, under the NHS that are going on strike, as far as I know.
Okay, so since 2008, that's when their pay So that's when the pay changed, right? Since 2008.
Yeah, so since 2008, with what the levels they were being paid back in 2008 and the levels they are being paid now, it's equivalent to a 25% pay cut since then.
Okay.
Yeah.
So how can the public do? Because I didn't know about the doctor strikes if you were my doctor friend and, told me. And I didn't see any social media support or any posts or anything about it.
Really? That's quite interesting.
Yeah.
I think it's been going on for a while. This whole kind of tussle, I guess, between the government and the doctors. So I guess people are kind of, the news and things like that might not be as akin to it, but I think reading up about it and trying to understand what's going on and the impacts that it's having is quite vital.
There's a lot of questions. I'm just going to read you. It says, how can we ensure that the concerns of junior doctors are effectively addressed and resolved without the need for strikes?
Oh, that's a big question. I think listening is the first thing. I think a lot of it, obviously, it's between the BMA and the government. So this is a great question for the government, I guess. But me personally, if I were to answer it, I think listening to their concerns, trying to see it from our perspective. I don't think anyone can really truly understand what being a doctor is like until you've been in that situation, or even working in the NHS and working in the hospitals. For all of the professionals that are there, I think they all deserve a pay rise. But all of those professionals that work in a hospital environment day to day, how stressful and how long and how tiring it really is. But also then the pressures of what you're dealing with, because you're dealing with people and people's health, which is such an important thing. All of those strains day to day and the years of training that leads up to it. I don't think people can realize that. And I personally don't think those that are in authority and those that decide the wages have that understanding, because they've never been through it.
Yeah, I completely agree. I only go to the hospital and I get so overwhelmed. So I can't imagine working. And it's obviously, like you said, it's people's health. So it's not something that's you can just look over, you know?
Yeah, because it's not a job where you can just kind of not put your full into it. And I know that everyone does work really, really hard and probably gives their whole 110% to their jobs, but especially with your doctor, you'd want them to be giving their 110%, if that makes sense. And with the ways things are at the moment, with, you know, increased amount of patients in more complex kind of conditions and things like that, I'm sure it is really, really hard. I don't know, I'll find out inshallah in August, but yeah, it does seem quite hard. And so I think, you know, we need to think a bit more about what's going on. I also just wanted to say like a few questions that I had with regard to the topic, and something that is always on my mind. When there aren't enough doctors on the wards or things like that, the hospital can put out a request for a locum doctor. So this is a doctor that can be brought in to fill in that gap. And then locum doctors' rates are a lot higher per hour. So an average F1 locum rate is about £30, £30 to £75 in London, which is quite a lot more than the £14.30 that we were talking about earlier. And that's why a lot of doctors might take a gap out of their training to just locum, because their hourly wages are a lot higher and you can earn quite a lot more than a full-time salary doctor. But I guess the biggest question that I have, I don't know, I haven't really seen anything online that's answering this, so it'd be great to find an answer for it if anyone does know. But surely it would be cheaper to pay full-time salary doctors £19 something an hour than it would be to hire large amounts of locum doctors who are paying £30 to £75 an hour, and that's just at the very junior level. Like, some things like this to me doesn't make sense. So yeah. Green, I think you're
sorry, let me.
muted.
Yeah. Forgot to mute my mic. Is there anything else you want to add?
No, I think that's basically everything. I think reading up about it is really important, reading up the costs, because at the end of the day, the NHS is our system. A lot of us might not have private healthcare, and we have a system there that is a point of care system. So whenever we need it, we can go to it. And even though at the moment it's not great, I think starting to fix issues like, you know, employees' pay in the NHS is a step that we can take towards trying to bring the NHS back on track. Obviously, there's so many different issues as to why the NHS is running the way it is at the moment, but I definitely think that employees' pays is one of those contributing factors, and I think we need to take each factor and try and resolve it. And I think for everyone that's listening out there, the NHS is like, it's our system. It's where I would go if I had a health issue. And so I'd want it to be, you know, at its peak. And I want it to be there. I don't want to be in a country where I don't have the NHS. So, yeah.
I mean, you're working here, so you would need the NHS.
But not only that, like for my own healthcare, to be honest with you, a lot of us, I wouldn't be able to afford private healthcare. A lot of people won't even be able to afford it. So, you know, for us to have a healthcare system that's point of care is so important. And especially where a lot of us have been to other countries around the world. For example, I visit Bangladesh quite frequently. Going there and seeing what their healthcare system's like, and obviously it's not as advanced as us, but the fact is they don't have a point of care system. Like, you have to pay if you want decent healthcare. And this is the thing, it's so hard for people at a point of need to be able to come up with that money and then pay for it. Why do we think there's going to be any different here when healthcare is so expensive out of it being subsidized, nationally? My opinion.
Yeah, all opinions and views are our own on this show. We have about a minute to go, so anything else you want to add on Dr. Strikes, Lemisa, this is your time. I mean, you've said a lot already.
Yeah. I tried to fact check everything where possible. So all of my kind of sources are from articles like The Guardian or the BBC, things like that. But if there were any mistakes, I apologize for my oversight. But yeah, I think it's a really important issue and it's pertinent to all of us. So yeah.
It is really important, and I didn't know about it. So just you coming on the radio and talking about the junior doctor strikes is really important, and I think we are gonna, feel the lack of junior doctors because they're on a strike. So just join us in the next half. We will be welcoming 2024. Assalamu alaikum wa rahmatullahi wa barakatuh.
Assalamu alaikum, this is Atif Nawaz. Listen to Inspire FM shows in your time by heading over to inspirefm.org or listen on Apple Podcasts or Spotify. Ya hala, ya hala, ya hala.
Assalamu alaikum, everyone. Welcome back to Sisters Speak. We are now on our second half where we are going to welcome 2024, kind of give what we expect from this year. Last week's show was our reflections on 2023, and we just reflected on the year, what we did. So this show is going to be about 2024. So I'm here with Lemisa. Say hi, Lemisa.
Sorry, everyone.
I'm just curious to know, how did you celebrate your new year, Lemisa? I know there's different ways depending on, where you are and kind of what you believe is going to bring you luck this 2024. So I'm just curious to know, how did you celebrate?
I don't know. I don't really think I, have any superstitions or anything like that, or any rituals or anything like that. Personally, I don't have that type of stuff. I just saw the fireworks at 12, really, and that's about it. Because I just generally like fireworks. New Year's is often that opportunity to see a bunch of fireworks going off around. And I think in Luton, loads of people do. There were like so many I could see in the horizon, so it was nice to watch.
Oh, okay. I think it's really normal in the UK to just see the fireworks when New Year's, but normally what I do every single New Year is eat the 12 grapes, which is a really, Spanish tradition.
Is that a Spanish? Yeah, I was going to say, is that Spanish tradition?
It's really Spanish. But the thing is, the New Year in Spain is 1 year before us. So we all eat the grapes at 11 p.m. instead of at 12.
Oh, it's an hour before.
Yeah, so we eat 12 grapes, one for each month.
Nice. Do you know what that tradition is kind of like what the history behind that tradition is?
So I'm just going to go ahead with the question then. Are there in what ways do you plan to contribute to making the world a better place in 2024?
Well, that's a big question. How am I going to contribute to make the world a better place? Is that the question?
Yes, sorry.
No. I think the biggest way that I can do that is maybe by developing myself. So I think that's my focus, really.
It goes back to your thought of the week, doesn't it?
Yeah, exactly. What about you, Fareen?
I'm not sure, In what ways can I contribute? I think just being a bit vocal about the issues that are going on, that's my main way. I think this 2023, I've been really silent. Not silent, but I just didn't have the guts to say whatever the issues were. But this year, I'm just going to try to be vocal about them.
Okay. I think that's good. I think I'm going to take something along the same lines and try and be more well-versed in issues that are going around the world. I think a lot of us know of things, but I personally know about things that are going on, but I don't necessarily read into the issues, i.e. the factors that contribute to it, why it's happening, who's being affected, that type of thing. So I think actually reading up about it and learning more is something that is important for next year
I
or
agree.
this year.
I think like yeah, this year. I think like trends, we just tend to repost whatever we see without actually reading what is it about.
Mm.
So just yeah, just learning about all of that. Is there any ways do you plan to challenge yourself and foster a bit of personal growth? I know you said in your third day you wanted to improve yourself. Just any specific ways that you're going to do this?
I think actually last year I tried to challenge myself a lot. I tried to put myself in situations where, I was meeting new people and things that I was doing things that were outside of my comfort zone. I think this year what I want to do is push myself to work harder towards the goals. So rather than just have them as kind of like there might be certain things that'd be like it'd be nice if this happened, but rather than just thinking of it as it would be nice if it happened, I want to turn it into an actual attainable goal where it does happen. And so I think I want to, be a bit harder on myself and actually start running towards those.
So you just want to challenge yourself, basically.
Yeah, I want to. Yeah, I'm especially like, I guess academic wise and things like that. I really want to put my head down and want to make sure I push myself.
Yeah, that's one of my resolutions, but we know it never happens.
No, it's going to happen this year. Okay, we're going to be academic weapons, inshallah.
For my personal growth, I think I'm gonna really think about my friendships and who I'm actually being friendly to and who I'm building a friendship with. I feel this 2024 was such a messy year in regards to friends, and there were so many changes. I was finishing sixth form, starting uni, so there's so many factors that just change the way you're. Because these are friends that for so many years. You're in one place, but then the second you move to uni, you're far away and everything. So obviously the dynamic changes, and there's people who are going to understand it, and people that are going to think that you're not making the effort. But it's like I've said so many times this before, it's just life, and I think one of our whole topics we're going to be learning to be an adult. But yeah, just my friendships this year and who is a real friend is something that I'm still learning, looking for. Yeah, that's it. That's kind of my how I'm trying to, because friends are such a big part of your life.
It's a huge part. Yeah, it's a huge part because the people who you surround yourselves with are ultimately going to have an effect on you and the way you live your life. So it's really important Islamically as well that we pick out the right types of people to hang around with. And it's something that even like fully grown adults, like grown adults, struggle with picking company. And so I think it's something that we're all trying to navigate. Yeah,
I completely agree. Are there any upcoming events this 2024 that you're looking forward to?
I don't know. What are you looking forward to, Tree?
I'm not looking forward to anything.
You're not looking forward to anything?
I just want to try to get through my first year of the uni. I was going to say get my degree, but that's really far away.
But that's a big thing, finishing first year of uni. You're going to have so many, because quite a lot of the academic year is left, and uni is such a large like transition period for you. Yeah, it's a very big thing.
I think that's it. With milestones, I'm trying to like grow kind of Islamically and learn a lot. So I joined a course, a 10-week course. I don't know if I said this before, but I joined an Islamic course, and it's about it's like a preparing for Ramadan kind of course. Like we mentioned, there's 3 months left for it. So
that's really great.
Thank you.
What are some of the, like it's preparing for Ramadan, but what are some of the things that it's kind of going through and that you're hoping to try and implement over the next few months?
Just praying on time. Like kind of the basic stuff. And the book is also, it's like a book club kind of thing.
Okay.
And it's with other girls and everything. So I'm really looking forward to that. And it's gonna start from next week. So I'm just looking forward to that.
I think that's a great chance to meet like people as well who are obviously on the same goal that you're on. And it'd be nice to have those discussions with them and kind of see how you can push each other forward.
Obviously, it's only the 3rd of January. And did you have any resolution?
My resolutions have been the same for a very, very long time. So I had this kind of these areas that I know I need to improve in, and I've been trying to improve. And I guess I've made some progress in some areas, but that, where you can say you've achieved that goal, I don't think I've done it yet. But I guess in a way, a lot of these goals aren't, it's not a one-stop thing where you've achieved it. It's a continuous thing. So yeah, but I am looking forward to this year in general, I think. It's another year of life. I'm happy for every single day.
You're breathing.
Yeah, I think I'm looking forward to just keeping an open mind and seeing what happens. And I think one of the biggest things that I want to develop actually is just being a lot more stress-free. And I think I look forward to this year in that sense, that hopefully I'll be able to implement that mindset. And so it'll be, much more chill. That's my aim.
That's such a good aim, because stress takes so much time out of your day. You spend more time stressing about things than actually doing them.
And a lot of it, like, it's just, I don't know, I think for a lot of us, it's almost like second nature. Like, loads of people talk about how they procrastinate for work and things like that. And it's a very normal thing. But I think, like, it stems from worries and underlying stress about doing the actual thing. And so I just want to mitigate, I just want to get rid of that, basically. And I just want to live life and take things as it comes. I think that's a more like breathable attitude, if that makes sense.
Yeah, there's this thing where I used to do when I was young, that was anything that I wanted to do, I would start from like the 1st of January, and that's basically at 12. It's 2024 already, so I would start from there.
Yeah,
and it's obviously something, it's not realistic. You can't start stuff from 12 a.m. from that day to the next one. So you have to kind of mentally prepare yourself to do that.
I agree. I think for a lot of people, the reason why we have resolutions at this time of year is just because it's in our mind, it seems like it's a new start, if that makes sense.
Yeah, it is a new start and so many things are gonna, we're gonna see so many new things this year. I think that, scientific stuff and social media is gonna be so big. So let's see. Let me look for more questions. So do you have anything to say about the environmental change that 2024 is going to have, and some positive changes that we can make in our daily lives?
Environment is so important. I feel like we used to talk about it a lot on the show, and it's such an important issue. And yet day to day kind of takes over, and we don't see the effect that we're actually having on the world, which is so terrible. But everyday things like looking at energy consumption and ways we can save that, looking at, a lot of people do litter. Not littering is such a big thing. Just keeping hold onto your rubbish until you find a bin and chuck it away. And I think recycling is really important. And I think actually our national system for recycling needs to be better. We need to make it easier for people to recycle so that we can, reduce our consumption. I think that's a really big issue, but not a lot of focus is given to it.
Yeah, I think we have to make a whole show on this topic.
Yeah, because loads of other countries actually around the world make it very, very easy. On the packaging, it's easy to know how you're meant to recycle the thing that you're recycling. You have different bins, different coloured bin liners, so people know exactly which bin to put what in. And this all comes, like, it's a nationwide approach. I think those are the types of approaches that we need to start implementing in the UK, because I don't know, I find it, like, low-key, I find it really hard to recycle. I don't know if that's just a personal thing.
I just get kind of lazy to it, but obviously you have to do it, otherwise you get that little sticker on your bin.
And then you don't know, because like for example, in institutions and things like that, it will have one that says like paper waste recycling and another one that says like a different type of recycling, and then you don't know where your rubbish lies, and it's quite confusing. And it's like your heart's in the right place because you want to recycle it, but you just don't know how. So I think these types of issues need to be brought up on the list,
Yeah, I completely agree. Obviously social media is so big now. Do you think social media is going to change in 2024? Is going to expand more, like the technology advancements?
I have no idea. I think social media is very, very big at the moment, obviously, and there's so many different like platforms. Whether we have, you're in a better position to answer this question, Farine. As a person who uses a lot of social media, but also you're in like the computer science field, what do you think?
Obviously technology is always expanding literally every single day, but I think that we're gonna be so much more consumed by social media. There's literally like people are gaining $9 million for one publicity ad that they're doing by brands, social media influencers and everything. So it's gonna expand so much this year. And people's solutions are literally becoming social media influencers, which I get it because obviously you get a lot of money, you don't have to do much. So it is gonna expand. But for me, I'm gonna try this 2024 not to use any social media like that much. I'm just trying to implement that, like you said, stress-free life, taking care of my mental health because
I do think that a lot of people are kind of gearing towards it though. Like it makes sense because with social media, it's fun, number one, to do. A lot of people enjoy it. And you create a community as a way of connecting with people. And if you can make money off of it, it's a great thing. So I think loads of people are kind of gearing towards how they can make a social media presence. But at the same time, I think a lot of us kind of want to take a break, you know, and kind of take a step back from social media and all of the information overload that comes from it. Our attention spans, I don't know about everyone else, but I feel like my attention span has definitely decreased from the start of like consuming short form content. And it's so easy to just scroll and mindlessly scroll. And sometimes your brain doesn't want to watch. When we look at the entertainment industry traditionally, like films and TV series, they're at a certain length and you have to get invested in the storyline and things like that. And sometimes from work, we are so tired and so exhausted that you don't even want to watch that. So it's easy to go on social media to do a mindless scroll and kind of take time that way. And so I do think like, for me, it might be impacting the way I work, or it definitely has impacted the way I work because I find that I found previously in 2023 that I wasn't able to concentrate for longer periods of time. And so I decided to take that into my own hands and kind of change it in a way. And my phone really helped with that because I have no storage whatsoever, so I can't have any apps. So I can't have like your big social media, you know, apps like Instagram and YouTube that typically have the short form content, and so it's really inconvenient for me to go on there, but it's helped because I can do things for longer periods of time, and I've found that my screen time's reduced and I have a lot more time in the day. So yeah, and you know, apps are literally designed to make you addicted, so just you trying to escape that thing is just enough for you. Like I'm gonna just go with TikTok because it's my main app. The auto scroll, and you don't even have to use your hands to kind of scroll. Yeah, there's so many things, or your notifications even. All of that is just made to make you addicted to that social media app and just scroll for hours and waste your time. I see. And whilst I guess it's nice to be able to connect with other people and see what they're doing, I think to the point maybe that a lot of us do use it where it takes up a lot of our time. I think that's when we need to start rethinking and maybe trying to introduce balance. But yeah, guys, if you do have anything to say on our topic, or you kind of have any thoughts that you want to talk about with regards to your plans for 2024, or how you might want to better develop yourself this year, please do text or WhatsApp in on 0777 948 1822, and also call in on 01582 481 822. We really do want to hear what you guys have to say about the topics that we talk about. We're also active on Instagram, so at Sister Speak is where all of our content kind of goes up, and our show is available on Apple Podcasts and Spotify. So every single radio show that we have every week is available on there for you guys to listen to again. So yeah, we'd really appreciate it if you did listen to those throughout the day if you can't catch the show on Wednesdays at 6. And yeah, Doreen, do you have anything to say just to finish off the show?
I just want to wish everyone a happy new year. We hope to see you next week, inshallah. And yeah, have a lovely 2024. Let us know all your resolutions on our Instagram at Sisters Speak. Assalamu alaikum wa rahmatullahi wa barakatuh.
Assalamu alaikum wa rahmatullahi wa barakatuh.
Thank you for listening to our podcast. Why not tune in to our live stream at inspirefm.org and follow and subscribe to our social media platforms at Inspire FM Luton.